just some amazing reporting, absolutely breathtaking reporting from ProPublica and Lever News about Medicare Advantage and, in general, our for-profit health care or health insurance system, which is something that most other countries don't have, or if they do, it's just a little thing on the side for really wealthy people who want, private suites when they get in the hospital, as opposed to, a room with a roommate kind of thing. And that is the story from Lever News. This is David Sirota's newsletter, levernews.com. The headline, "An Insurance Giant Stalls Mental Health Care Reform." He says, when Jennifer's 15-year-old daughter was back in the hospital after another psychiatric emergency, Jennifer knew something had to change. They looked around for a hospital that would take Jennifer. They finally found one. It was 11 hours away. It was $10,000 a month. It has cost the family $80,000 to save their daughter's life. They live in Michigan. Blue Cross Blue Shield of Michigan was their insurer. Michigan law requires insurance companies to provide parity for mental health care. In other words, to pay for mental health care bills just like they would pay for physical health care bills. If their daughter had broken her leg and it had cost $80,000, Blue Cross Blue Shield would have paid for it. But because her mind broke, Blue Cross Blue Shield is telling them to go screw themselves. Jennifer's mom says, I borrowed against my 401k. I took out whatever cash I had, and then the rest has been through loans, and a lot of them are pretty high interest. Blue Cross is doing everything in their power to make sure we don't get the care we need. And, like I said, this is illegal, but they don't care. They note, over the past 22 years, Blue Cross Blue Shield in Michigan has spent almost $7.4 million lobbying in Michigan, which brings us back to my first hour rant about it's all about the Supreme Court legalizing political bribery. There was an effort to pass a bill that would have forced them to pay, even though they're already required to. But Blue Cross Blue Shield lobbied and succeeded in preventing a vote on the bill. More than 1.4 million Michigan residents have a mental health condition, but nearly 40% of them go without care. Why? They can't afford it. These stories are so common, Lever News notes. In fact, a group of parents created a Facebook group called Advocates for Mental Health of Michigan Youth, which has over 1,300 followers. Amazing. Meanwhile, over on ProPublica, this just came out today, ProPublica.org, and it's shocking. And again, these are the same deal with whether it's regular health insurance or whether it's Medicare Advantage. It's the same thing, and they play the same games. Forrest Van Patten was 50 and strong after years as a molten iron pourer when he learned in July 2019 that a hyper-aggressive form of lymphoma had invaded his body. Chemotherapy had failed, but because he was not in remission, a stem cell transplant wasn't an option. But his oncologist offered a lifeline. Don't worry, he said, there is CAR-T, C-A-R-T. This is a new therapy. He was a good candidate for treatment. It's a therapy that works. It has been approved by the Food and Drug Administration. And as they write, Van Patten didn't know it, but he also had the law on his side. His home state of Michigan had long required health insurers to cover clinically proven cancer drugs. But then his health insurance company refused to pay for it. Across the country, they note, health insurers are flouting state laws like the one in Michigan, ProPublica found. Companies have continued to dodge bills for pricey treatments even as industry profits have risen. ProPublica identified dozens of cases in which plans refused to pay for high-stakes treatments or procedures, from emergency surgeries to mammograms, even though the law requires insurers to cover them. Companies can get away with this. I'm reading from the ProPublica report here today. Companies can get away with this because the thinly staffed state agencies that oversee insurers typically don't open investigations unless patients file complaints. And most patients don't even know how to file a complaint. In the 34 years since Michigan began to require cancer coverage, regulators there have never cited an insurance company for violating the law. Never happened. Dr. John Fox was a chief medical officer for this insurance company that's denying this guy's claim. And he says, patients' needs aren't part of the equation. He said, instead the question is, this is really expensive. How do we prevent payment? This is how these companies make their money. They're parasites. They're like giant leeches, like giant ticks stuck on our backs, sucking the blood out of us. We need Medicare for all. We need Medicare for all Americans. And I'm not talking about Medicare Advantage for all Americans. I'm talking about actual Medicare for all Americans. Company after company. Today, just go to ProPublica.com. You'll see they've got 4 different articles about health insurance companies, including Medicare Advantage health insurance companies, simply refusing to pay for people, for the things that would save people's lives. This guy, they're talking, you know, he's sitting here in his hospital bed sobbing. You know, this could save his life. It has saved the lives of hundreds of other people. But his insurance company won't pay for it because it costs over $100,000 for the treatment. And he's been paying into this insurance for years. This is beyond wrong. This is criminal. We need to do something about this. We need to be electing officials who will hold these companies to account. We need to be passing laws that will hold these companies to account. We need to be informing people that when your Medicare Advantage provider or your health insurance company turns you down, that you can call the state insurance commissioner and file a complaint. I'll be right back.